In our NICU, most kids actually aren't that premature. Most kids are late preterm or term, and most of them actually come into the NICU for something parents don't expect, which is retained lung fluid. It distresses the parents because they weren't expecting it, even though the kids are going to 100% be normal and have no problem. The lungs make fluid. The lungs are actually expanded in utero, but they're full of fluid. They're like if you put a sponge in a bucket of water. The sponge isn't crumpled up, it's fully expanded. If you don't get induced or everything, you just come in labor, the lungs have actually shifted from making fluid to absorbing fluid. So once the baby's born, they just have to cough the fluid out of their airways. The sponge is not waterlogged. So retained lung fluid essentially is you have a wet sponge, you did the dishes, it's soaking wet, and you haven't squeezed all the water out. If you squeeze most of the water out and it moves normally, well, it's going to be fine. And so when I explain to parents, I say, listen, your baby's lungs are like a sponge. The lungs are waterlogged. Your baby could be off this oxygen in 2, 4, 6 hours, or it could be here 7 to 14 days.